Let's talk about Australia today. Um, Global destigmatization efforts continue, and we've seen more and more high-profile names tiptoe their way out of the green closet. But it hits a little different when we get past the celebrities and athletes and hear lawmakers talk about their own consumption habits. That's exactly what's happening in Australia, but does a couple of big name down under MPs, members of parliament, for those of you who don't know, proudly admitting that they're down to sesh with some of the best of us, mean that the largest country in Oceania will soon be legalizing? A recent survey of 1,000 participants conducted by a consumer insights company, Antenna, it's a weird name for a consumer insights company, but okay. Revealed around 8% of Australians are using medical marijuana after either occasionally or regularly. Cannabis broke down the Metagrowth Commission study, revealing 22% of respondents either contemplated or obtained a cannabis prescription within 12 months, while 4 out of 10 would be comfortable telling their employer if they were taking the medicine. Very open down there. I like that. The study's results came in wake of Victoria's Premier Jacinta Allen, Treasurer Tim Pallas, and opposition leader John Pizzuto, all owning up to experimenting with with cannabis at different times in their own lives. Australian political publication The Age reported that the revelations were made following the Labor government's indication that it would consider decriminalizing cannabis for personal use. Legalized Cannabis Party introduced a bill to legalize personal cannabis use in June, and the measure was introduced in Parliament in Victoria, New South Wales, and Western Australia on the same day. On Wednesday, Mental Health Minister Ingrid Stitt said the government's open to collaborating with experts, the community, and the legalized cannabis party regarding the potential legalization of personal cannabis consumption, but the Labor cannot back the bill in its current form. Here's what she said. In relation to this bill, that proposes to legalize the adult personal use of cannabis beyond the required for medicinal reasons, we are unable to support it in its current form at this time. Though he did say that he dabbled in the past, Premier Allen was also tepid in his own response during a presser on Thursday. Of course, we would get advice. Of course, we would seek advice. And in this instance, advice from the health experts. That's why we have indicated in the House yesterday that we would do what we would do, but it doesn't necessarily mean that there's a change to government policy as a consequence of these discussions. From a report in The Guardian, Treasurer Palace is open to adopting a health-focused strategy when addressing cannabis-related issues while avoiding laws that criminalize the plant. In a debate on Thursday, he said this: "I don't think a criminal approach to this is best. A health approach would be best." And NSW is lagging on the cannabis reform. Meanwhile, under a measure introduced by in I'm just fumbling on my words today. I'm sorry, y'all. Under a measure introduced this November in the New South Wales Parliament, could legally gift friends cannabis, grow up to 6 plants for their use, and possess a maximum of 50 grams. And that came from Vice. Legalized cannabis MP Jeremy Buckingham, who's behind the reform push, brought a butt of weed. Brought a whole butt. It didn't show the picture of it, so I don't know if it was, like a big cola. I don't know if it's like a little small little popcorn. But he brought a bud of weed into Parliament, emphasizing that even though he obtained it legally by prescription, allegedly, he would have ended up in jail if he gave it to someone else. What's to be afraid of? Here it is, Mr. President, a bit of cannabis, medicinal cannabis. I note, Mr. President, that if I gave this medicine here to you, you would suffer a penalty of $10,000 and 10 years in jail. And so would I. It's a big point right there. I wish somebody would do that to Sleepy Joe in the session of Congress. I don't think American politicians have the balls to do that though. But separately in August, David Shoebridge, Greens senator from New South Wales, presented the Greens legalizing cannabis bill 2023 on Thursday, which would allow adult use cannabis across the country. Interestingly, the Australian Medical Association does not support a measure from Shoebridge due to the potential health risks associated with the plant. Legalizing cannabis for recreational purposes sends the wrong signal to the public and especially to young Australians. That cannabis use is not harmful. This is what Steve Robeson, professor, president of the AMA, said. And medical cannabis-based PDLX gets the green light by Health Canada, and for their synthesized CBD oral solution by Jazz Pharmaceuticals PLC. It's been approved by the health. It's been approved by Health Canada for use as adjunctive therapy for treatment of seizures associated with Lennox-Gastaut syndrome. I have no idea what that is. Maybe my doctors here can help me out with LGS is. Dravet
Seizure
syndrome,
disorder.
seizure. Okay. Dravet syndrome. What's that one?
Dravet
Dravet,
syndrome,
another seizure disorder.
That's
a
not
form
Okay.
of
right.
intractable, a
Or
form of
tuberous.
intractable epilepsy that doesn't typically respond in some cases to anti-seizure medication.
Interesting.
Excellent. And tuberous sclerosis complex. What's that one? I feel like Jason today.
It's
Yes. Tubular
it's a
sclerosis.
malformation in the brain. Same gives you seizures though.
Okay. So Health Canada approval was based on results from 5 double-blind randomized placebo-controlled phase 3 clinical trials with a total of 939 LGS Dravet syndrome or TSC patients enrolled, making it one of the largest global clinical trial programs to date in rare refractory epilepsy syndromes. The approval of a PDLX is an important development for individuals living with specific rare epilepsies, their families, and clinicians across Canada, providing a new treatment option for those living with LGS, Dravet syndrome, or TSC. Major moves being made down in Australia. We don't know how close they are to a legalization movement, but it looks like Canada's making moves too. So not all is doom and gloom for our neighbors to the north. I'm interested in hearing what everybody else has to say about this. Big ups to the land down under. And I want to hear more American politicians coming out of the green closet too. I'm Rico Lamitte, the dopest dad on the street. Happy December, everybody.
Oh yeah, it's December 1st. It's the first of the month. And man, I mean, it just sounds like these guys are just making it easier and easier and easier for the pharmaceutical industry by allowing Epidiolex to be there. And while Epidiolex does help people, I didn't see a lot of things that in this article, or maybe I'm confused, Rico, but I didn't see a lot of it talk about like adult use and them allowing that. They're just talking about medicines.
I mean, cannabis is medicine.
I agree with that. I agree with that. But
Taking.
yes, but
I
Epidiolex is
I
a
do.
pharmaceutical grade medicine.
Yeah.
There is no cannabis
Wasn't
product.
the article
Go ahead, Dr. T.
wasn't the article talking about adult use? Wasn't that what the article was about? Adult use, getting
Yeah,
an
they said
adult
that.
use
Yeah, the whole point of the article was talking about like the irony
Yeah,
of
hypocrisy.
the parliamentary members saying that, yeah, I used to use weed, and then another guy comes into the chamber and offers some weed to the president. And I would love to see a member of our Congress do that, and they're pushing for it, but it seems like the government is just taking their medical stance, and they're sticking to their guns, and they're saying medical is medical, but the public is shifting. These surveys that they're doing with the public are saying that more and more people are saying that they're open
Mm-hmm.
to legalization or adult use, and more and more people in Australia say like, yeah, I'll tell my boss now without it even being legalized. So seems like they got more guts than Americans do. So I don't know, man. This is pretty. It's pretty weird to see that the ones in charge are like, okay, we're going to keep on going down the medical route, and that's it. We're only going to be supporting what the medical use and the studies are
Mm-hmm.
telling us right now is
Exactly.
that has been proven. But the people are saying otherwise, and some of the members of Congress are saying otherwise too.
Yeah, but they're saying it, but they're not doing anything.
Nope, they're not. Not yet.
Exactly.
Well, I
They're not.
agree with the people.
I agree with the
Yep.
people too, Dr.
You
T.
know, 20 years ago when I got into this industry, I told myself that I wouldn't stop legalization from happening because cannabis is safer than aspirin,
Mhm.
and anyone can go into a CVS and purchase some aspirin. The problem is honestly that the recreational market has diverted attention away from the medical use of it and sort of ruined the image of medical users, and that's been problematic. So, I don't know if I'm right to support recreational use. I think that honestly, I have to support recreational use, or at least access to cannabis without needing a doctor's recommendation, because it is fairly safe. But let's not forget the patients here. They need it, and we need to study it.
So Dr. T, you're just like, if cannabis was just available over the counter, that would be the way to go, which basically it is through adult use, is what you're saying. And under those
Yeah,
pretenses,
that over the counter rather than
yes,
this adult use
yeah.
recreational.
Maybe we should start using that terminology of over the counter.
You got it.
Instead of adult use or even recreational, just over the counter.
That's right.
Yeah. OTC.
Yeah.
That's right.
I'm not mad at that.
OTC OG.
Yeah.
What about home grow? Is that just
yeah.
counter?
A home grow would be
kitchen
over
counter?
the home grow would be in the back of the counter, technically, Dr. Mark.
Under the counter.
That's the
under the
that's the
cabinet,
kitchen
yeah.
counter.
In the
And
cabinet, yeah.
let's face it, cannabis is not a drug, right? It's a medicinal herb, and it needs to be regulated as such. And when a medicinal herb can provide relief to a human illness or condition, and there's many cases where cannabis can, it should not only be lawful, but it should be encouraged before taking other pharmaceuticals with their litany of toxic side effects.
But the problem, Mark, is that our FDA is really a poor track record in regulating botanicals, right? Medicinal herbs. They are horrible at it, and so we run into problems whenever we ask them to do it. I mean, they've had hundreds of applications for medicinal herbs and only have approved 3 or 4 of them. So that's this really, they don't know how to deal with it.
They've recognized that they need a new regulatory pathway. But I think the thing is that I think what this article really describes is that medicinal is often the thing that opens the door to adult use or recreational, whatever you want to call it, just full legalization. I mean, that's the way it's happened in many states, including California. Medicinal is first because those are the people who need the plant to stay alive. Recreational use is just agonism of your CB1 receptors. So, I mean, everything's medicinal, right, Doc? I mean, I don't want to preach to the choir because I think we're all on the same side of this, is that, there is no role for the pharmaceutical companies to play here because this is off-patented herbal medicine that's been used by humans for millennia, and it just doesn't neatly fit into the FDA clinical trial regimen. Albeit there are bold companies that are taking things like CBN through clinical trials with humans to prove anecdotally what we've kind of known for years is that CBN helps with sleep. There's now actually the publication that Dr. Talleyrand covered last month here on High at 9 News that actually showed clinical data that CBN actually does work. I think that's Australia's tack here, is to use, we've known for years that CBD can control epilepsies. Dr. Talleyrand, I've seen it with my own eyes. I've seen a kid in the middle of epileptic seizures get a dose of CBD oil under the tongue, and the seizure stopped. I saw it with my own eye. I again, was skeptical, but I think that tells you that there is something to this, and certainly for those parents that are suffering, anguishing, existence with these children that have this intractable form of epilepsy that doesn't respond to typical anti-seizure medication, Jason. That's an important distinction here because there is a litany of medicines that are used to control seizures, but some of these things just dope the kids up, and now they just have a terrible existence. It's not.
Dr. Mark, just to speak on that, I had that happen to me. I had a grand mal seizure in my sleep one night and woke up in a hospital bed the following day, tied down with a catheter, ET dots all over my chest, big old tube going down my throat. It was insane. Okay. And the doctors put me on Dilantin, on anti-seizure medicine. and I started just having crazy side effects from that. I would sleep for like 20 hours a day. I didn't like being around anybody. I actually hated just even living. It was totally miserable. And I went to the doctor and I told them all of these different side effects that I was having from the medication. And do you know what happened? They took my blood, okay? And this is the most craziest thing ever. They took my blood, and then the levels of the Dilan were supposed to be in between 10 and 20. My levels were over 30 when they took my blood, when I told them I was experiencing these different things. And they made me actually they drove me over to the crazy house to detox off of the pharmaceutical drugs that they had prescribed. It was absolutely crazy, asinine thing that I think has ever happened to me personally.
Just another convenient reminder on why it's called practicing medicine.
Yeah, well, that's what I told him. I said, I'm not his guinea pig, and like if he doesn't have I ultimately throughout that whole process, I ultimately quit Dilantin cold turkey, which they say you're not supposed to do at all. But basically, I just came to a point to saying where I would rather have fewer days with a higher quality of life as being my normal self, as opposed to the person that this drug makes me. And so I said screw it, and I totally quit cold turkey, and we're here today.
Yeah, I mean, so the bottom line is how this article and how this realization in places like Australia that knows that CBD has its place in helping with intractable treatment of intractable epilepsy and related disorders is that has to unwind the Schedule 1 listing of a plant from which these substances are derived.
Mm-hmm.
How can something that acts so quickly to end seizures in kids be from a plant that's Schedule 1, which by definition has no known medical use? No.
Mm-hmm.
It has to come unwound.
Yeah.
And there needs to be more sensible, realistic regulation. And this has to, I think, happen with Congress to change the laws. And I think the DEA and HHS throwing this Schedule 3 thing over the fence at each other is all a bunch of hooey. Mm-hmm. It's a bunch of bullshit. They have to remove cannabis from the schedule because there's FDA drugs that are approved with the active ingredients derived from said plant, okay?
Mm-hmm. Yeah.
That's it.
That's crazy.
Dr. Mark, I think you're onto something with you saying there's a bunch of hooey right there. We have to hit them and talk to them in their language and tell Joe Robinette Biden that this is a bunch of malarkey.
If you want to speak to Joe Biden in his native tongue, then you need to be in dreamland sleeping, Rico.
How about a hee-haw for that, Jason?
Yeah, I don't know. It's not on the soundboard yet, Dr. Mark. You can't just expose that. Yeah, it's not ready yet. It's not ready yet.
It wasn't ready.
Donkeys and elephants, man.
Yeah, man, it's coming.
We're run by donkeys and elephants.
That's right. Crazy. That's right. That's why we prefer elephant stampedes.
Let's go to the island of the Dr. Moreau and get some hybrid beasts in there. How about that?
Oh, there's the donkey. Yes, there's the donkey. There we go. Adam got it together. Shout out Adam, the production specialist over here at High at 9 News. Yes.